Okay, 123 A&P. Let's knock out this presentation on the heart. We're going to talk about the structure and function of the heart, which is the pump, drives the cardiovascular system, and there are various components of it. Let's get to it. So, the cardiovascular system consists of the heart, blood, and circulation. That is, the heart is going to serve as the pump. It's going to help to distribute blood along the circulation, which consists of blood vessels, various sizes of blood vessels. We know that there are arteries and veins, and we've got the great vessels emerging from the base of the heart. The great vessels, examples of those would be the aorta and the vena cava, the pulmonary trunk. Sorry about any kids screaming in the background. They're playing a little board game on this for freezing Sunday. So the whole idea is that the heart is going to pump the blood and help to transport it around the circulation and deliver it to all of the A&P throughout the body. That is, all of the somatic cells, whether the cell is a liver cell or a skin cell or a muscle cell, or a heart cell or a brain cell. We're trying to drop off things like the components of the blood. So the oxygen travels on the red blood cell, nutrients, the glucose and simple sugars, amino acids and fatty acids that are going to be slurped through our intestinal wall and absorbed into our circulation. They're going to climb right onto that red blood cell raft and are going to float far and wide, distributing nutrients, oxygen, waste products, heat. All the immune system, white blood cells are all going to be transported along, courtesy of the action of the heart, pumping blood along the circulation. So there are two different circuits. We've got the pulmonary circuit, which is essentially where gas exchange occurs. The pulmonary circuit is driven by the right ventricle, and the contents of the right ventricle are essentially going to be ejected from the powerful myocardium in the right ventricle, and it's going to head out the pulmonary valve, which is a semilunar valve, which is going to go to the left and to the right. The pulmonary arteries, the pulmonary trunk branches into the pulmonary arteries, stops at the lungs on each side. Gas exchange occurs, oxygen is absorbed, and CO2 is expelled. That is what gas exchange is all about. That's driven by the pulmonary circuit. To the left, we have the systemic circuit, which is going to be driven by the left ventricle. Powerful contraction is going to accelerate the blood through the aortic valve, which is a semilunar valve, and that's going to head up the aortic arch. It's going to deliver blood to the upper extremity and the brain. Also, it's going to go, then the aorta is going to make a loop called the aortic arch, and it's going to go south along the spine, and it's going to finally bifurcate or hit a fork in the road at about the level of your navel. The navel, it's going to branch into the two common iliacs, which then feed the lower extremities. So the pulmonary and systemic circuits. Now we've got the heart. Where is it at? How do we locate it? Okay, it lives in a place called the mediastinum, which is the central soft tissue mass that lives just posterior to your sternum. This includes the heart, the lungs, and the great vessels, essentially. So that's where the heart lives. It's approximately the size of your fist. It's got an apex that lives about the fifth, sixth midclavicular line, which is where you can feel for the apical beat, which is the powerful beat of the left ventricle. You can palpate for what's called thrills there and observe for thrills. You got a really pounding of the chest. That's where you're going to find it. That's where you're going to auscultate or listen with your stethoscope to the heart. So there's the apex, the sharp point pointed towards the left midclavicular line, T5-6. The base is going to be right where the heart sits, right on top of the kind of a flattened area. The heart's gonna sit right on top of the diaphragm. That's the base of the heart. Heart's gonna weigh just short of a pound, so about 300 grams or 10 ounces. Name the two divisions of the cardiovascular system. Would be the pulmonary and systemic circuits. Boom. Pericardium is a bag which is going to surround the heart. The heart is contained within it. It's got two layers, a visceral pericardium and a parietal pericardium. And as stated in lecture, the visceral pericardium is actually on the surface of the heart, like just superficial to the myocardium. And then there's a little bit of layer of fluid, which is a serous fluid. And then there is the outside layer, or the parietal pericardium. So between the two layers and the lubrication in between them, you've got a almost frictionlessly beating heart, 60 to 100 beats per minute, normal range, right? So think about the friction, that all that beating, all that movement within inside a very close quarters, sandwiched between your lungs and your chest wall, etc., that creates. The pericardium and its serous fluid protects the heart and makes sure that it can beat almost frictionlessly. Yes. A condition associated with pericardium could be pericarditis, where we have inflammation of the pericardium itself. Think about what would happen if the A&P of the pericardium were to fail. You would have some pretty serious problems, as the friction would mount. Inflammation would cause the heart essentially to seize up within inside the cavity. So we can't have that. The heart, if you were to slice the wall and take a look at the various layers, there are three. The endocardium is the deepest layer. It's on the inside of the heart. It's very, very slippery. This is helpful because then the blood cells that are going to circulate and be pumped throughout the heart, they're like on a giant slip and slide. So the walls, they don't cling to the walls, they don't clot to the walls. The endocardium is just a smooth layer of simple squamous epithelium and some connective tissue underneath that. Perfect slip and slide materials. The middle of the heart lives the myocardium. The myocardium are the myocardial muscle cells, essentially. Myo means muscle. So this does the work of the heart, constant contractions happening, intercalated discs linking all these hearts so they can beat in one unified way. So the endocardium is the inside, the myocardium is the middle, and the epicardium is the outside of the heart, which is also more or less the visceral pericardium. So you see that yellowish area there, that's just a little bit of fat and simple squamous epithelium that lines the outside of the heart. Four chambers, the atria and the ventricles, right and left. So right atrium, left atrium, right ventricle, left ventricle. And then there are some features that separate these things. If you could take an actual heart, draw like an emoji heart, and slice it, put a crosshairs in the middle of it, you can basically create these chambers and see that they have some walls in between them. So there's something called the interventricular septum. All that is a piece of myocardium that separates the heart into right and left. All right. And then between these chambers, blood is going to flow in a certain circuit, and you need to know what that pathway is. Real quick, it is from venous return, coming from the vena cava, collection of deoxygenated blood from the superior and inferior parts of the body. That's all going to dump into the right atrium. Pressure is going to accumulate. It's going to dump, going to go through a valve called the right atrioventricular valve, or the tricuspid valve, and that's going to, then the blood is going to go south and fill up the right ventricle. Pressure is going to build in the right ventricle, and the blood is going to be ejected through the pulmonary trunk, which is a semilunar valve right at its base, and go through the pulmonary valve into the right and left pulmonary arteries, which are going to are attached to the lungs. Gas exchange occurs. Oxygenation. Now we've got oxyhemoglobin happening on the red blood cell. All that oxygenated blood is going to be sent and dumped into the left atrium via the pulmonary veins. There's a superior and inferior left and right pulmonary veins, so there's 4 of them, and they're all going to dump into the left atrium. Then that's going to fill up, and it's going to push open the left atrioventricular valve, or the bicuspid, otherwise known as the mitral valve. Blood is going to fill up, glug, 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 into the left ventricle, which is the largest ventricle and the most is the part of the heart that drives the systemic circulation. Boom! It's going to contract and it's going to push open the aortic valve, send blood coursing through the largest artery in the body, the aorta. It's going to be an aortic arch, and you see 3 sizable arteries coming off the aortic arch. They're going to go north to feed the upper extremities and the brain. And then we can see it loop-de-loop, and there's just the inferior aspect just passing across the base of the heart. We can see that the aorta is now traveling southward, and it's going to, during its course, it's going to supply everything, all the anatomy, from our intercostal muscles between each ribs to the kidneys, all the internal viscera. Finally, it's going to break into 2, fork in the road. It's going to come to a fork in the road, and it's going to be called the common iliac arteries then. And the inguinal arteries and the femoral arteries and the popliteal arteries, and it's going to go down and feed everything in the lower extremity. So that's tracing a drop of blood through the heart. A little spotlight on the valves here. All right. There's the atrioventricular valves and the semilunar valves. So you need to know the difference between them. One side, the right side in particular, has 3 cusps. They call it the tricuspid valve, or the right atrioventricular valve, whereas the left is the bicuspid. It's only got 2 little parachute leaflets, and they also call that the mitral valve. Just got to memorize it. As you can see, if you look at the heart, the inferior aspect of the heart, you'll see that those cusps attach to these cords, which are called chordae tendineae, and then they are going to link up with these little pink structures down there, look like little mountaintops, and those are called the papillary muscles. They will pull on the chordae tendineae and open up those valve leaflets. Pathway of blood through the heart, know it. The heart has to have its own blood supply too, so it's awesome that the heart pumps blood throughout the pulmonary and systemic circuits, but it also has to feed itself. The myocardium of the heart, as stated, is constantly contracting, and so it's every time those blood vessels, not the blood vessels, the myocardium contract 60 to 100 beats per minute, unified by the intercalated discs, ba-dum, 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 lub-dub, lub-dub, lub-dub. They are creating a waste product. CO2 is one of the waste products, and there are various others. So we need a pathway to drain the heart's muscles that are working so hard. We need to be able to drain the old blood out of it and re-nourish the heart. And that happens with the coronary arteries and the cardiac veins. So the arteries, you can see them as the aortic arch leaves the left ventricle. You should see that there's a little branch, like a little river, that is leaving. One goes to the right side of the heart, and one goes to the left side of the heart, and there's even some that go behind the heart, right? So these are called the coronary arteries. If somebody gets a coronary bypass, it means that there's a blockage in these arteries, and therefore we're going to have to, perform a surgical procedure to make sure we maintain proper blood flow and feed that part of the heart. Very, very important. Down low, our third little subject here, it says venous drainage. Those are called the cardiac veins. So there's different named veins, like the great and middle cardiac veins. I don't care if you know them. Just know that the basics, which are we have to be able to drain the deoxygenated blood from the heart and then replenish it with blood that is coming straight off the aorta across the systemic circulation. Oh, we can't forget the heart. So those are the coronary arteries. The heart, when it goes at lub-dub, lub-dub, we know that there's a contraction of the heart that is called systole, whereas diastole is the relaxation of the heart. And so when the heart contracts powerfully from its ventricles, the arterial blood flow is going to be greater. But when we're talking about the coronary arteries, you need to remember that the heart nourishes itself during the phase of diastole. So when the heart relaxes between beats, between contractions of the ventricles, that's when it kind of feeds itself. It takes a little bit of time out to take care of itself when it's on break between pumping blood everywhere else. Hopefully you can follow that. So when the heart is in the diastolic stage, or the relaxation stage, which happens between beats, that is when it feeds itself. What's a nerve supply to the heart? So the autonomic nervous system is going to control all of the viscera. That is the sympathetic and parasympathetic nervous systems. We know that the sympathetic nervous system resides in the thoracic aspect of the spinal cord. So T1 through 12, essentially. The posterolateral gray matter is going to, just remember that you see on the left, whereas the spinal cord is going down, those are the sympathetic fibers, whereas there are parasympathetic fibers that are going to come from the brainstem, or otherwise known as the craniosacral distribution. We have to have both input from the sympathetic as well as the parasympathetic nervous systems. We call that dual innervation of target organs. So if I were to fire the sympathetic pathways, you're stressed out, I put you in a tough spot, your sympathetics are going to fire, your heart rate goes up. And then the counterbalance to that is going to be that the parasympathetics are going to tell the heart, all right, slow down a little bit, you're getting a little out of hand. So there's a homeostatic balance here that must be struck, and it is the autonomic nervous system that plays a role here. Also note that there are cardiac centers within the medulla oblongata, or the brainstem, which are going to govern and control all of this activity unconsciously. What is cardiac physiology all about? It's about perfusion. Perfusion means how much blood flow do we have within the body. So the heart is going to pump, the blood is going to flow throughout the circulation, and it's a matter of supply and demand. If we're taking a jog, well, our skeletal muscles are going to require a lot of our resources when we're doing that physical activity. So the blood flow is going to naturally go to the skeletal muscles. All right, when we relax, when we're cooling down after our run, the blood flow is going to be redistributed throughout the body. You know, when you're studying, a lot of blood flow resources are needed in the brain, so we're going to have to find a way to serve that. In fact, that's always happening, right? Doesn't matter how much exercise you're doing with your skeletal muscles. If your brain's not functioning, if you're not getting blood there, then you're in trouble, right? So the cardiovascular system is all about maintaining homeostasis of blood flow. Hemodynamics. So how does blood flow? There's a collection of mechanisms that influence the dynamic circulation of blood. Dynamic means it's always changing. So there's an entire, like a feedback system. And remember, negative feedback is the most common kind of feedback. And this is going to ensure that blood flow happens all the time, and it constantly fluctuates to suit the needs of the human body. The heart is the pump. Here we've got the electrical conduction system that is embedded within the heart. This is its electrical system. So there are different parts of this. First is the SA node, or the sinoatrial node. This is the pacemaker cell. Now, all these little, it looks like wires almost embedded into the heart, and it is, but these are areas of the heart that where there's modified myocardial cells. So these are heart muscle cells, but they are specialized to help to maintain the beat. See, but you can think of it as like the heart's electrical system. The SA node is where it all begins. The atrioventricular node is the next stop. And then finally there's something called the bundle of His, and then all these little fibers that are embedded into the myocardium, especially in the ventricles. Those are called the subendocardial branches, otherwise known as the Purkinje's fibers. So here we have a nice image here. You can see that the point from which everything, all the electricity is flowing is in the right atrium, and that's the SA node. And then the next little oval you'll see down the path, that is the atrioventricular node. And then you can see there's a wire extending from that, and then there's a little point fork in the road where that's called the bundle of His. And then we're going to go off into the left and the right ventricles, and those are the Purkinje's fibers that look like little branches that are inserting into the myocardium. And here's the sequence. You can see all this happening very quickly. Lub-dub, 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 lub-dub. Constantly needs to fire and be correct every time. Now, there are conditions that affect people, affect the individual's heart. Like my father, I mentioned that he's got an atrial fibrillation, whereby the atria, the timing is just not right coming from the atria. Now, the atria are important, but if there was a problem with timing in the ventricles, then you'd have a real significant problem, because the ventricles are where large volumes of blood are pumped both to the lungs as well as the system along that systemic circulation. So he's under care right now, trying to normalize the electrical activity of his heart. Keep him in your thoughts. So which neurological structure within the heart regulates the pace of each heartbeat? The SA node. You can test the heart's beat for regularity or abnormality with an electrocardiogram. We can call this an EKG or an ECG. Patient presents to your emergency room with chest pain and shortness of breath, and their heart rate is up and their blood pressure is up. You're going to do an EKG to make sure that they're not having a heart attack. Here's the cardiac cycle, so how it's going to occur. We already talked about this, tracing a drop of blood, starting with a venous return, all the blood, deoxygenated blood, being dumped into the right atrium. All right, we call this the cardiac cycle. And here are the sequences of it. The atria contract. What's going to happen when the atria contract? Where we're going to push the blood into the ventricles through these valves called the atrioventricular or AV valves. Then the ventricles are going to contract. They're going to pump from the right side of the heart. The pulmonary circuit is going to be driven. From the left side of the heart, the systemic circulation is going to be driven. Step 3 is called ventricular ejection. If you look at this computer-generated model, you can see the myocardium and the valves and all this blood that is within the heart. Each one of those little swirls or lines is going to be the pathway of blood. So you can see that all that blood is being ejected, almost like a volcano spewing its contents very powerfully. All right, so the ventricles are going to eject their blood on the right and the left, and they're going to send the blood shooting out of these open semilunar valves. Those are previously mentioned are the pulmonary valve and the aortic valve, or the semilunar valves. After the ventricles contract powerfully, they're going to relax, and this is when the coronary circulation is going to be the greatest. There are different sounds that are made and that are believed to be created by the lub-dub, lub-dub, believed to be produced by the opening and closing of valves. So here they are, the heart sounds. They're clinically significant because when we're auscultating the heart, they provide information about the function of the heart itself. How are the valves functioning? And we can hear abnormalities. You could probably go on YouTube and listen to what a faulty or a malfunctioning heart valve would sound like, right? So what is the systolic sound? We call that S1. It's caused by the contraction of the ventricles and by the vibrations of the atrioventricular valves closing after all the contents of the ventricles have been ejected. That's S1. So the AV valves close when the ventricles contract. The diastolic sound is S2, and that's dub. So lub-dub. This is a little bit of a sharp sound. It's short, and it's caused by the closing of the semilunar valves after the contents of the ventricles have pumped through there. What force is responsible for the opening and closing of valves during the cardiac cycle? Pressure. It's all about the pressure. Cardiac physiology, there's something called cardiac output, which is essentially how efficient is the heart as a pump. There's something called stroke volume, and this is how much blood is pumped per heartbeat. And then there's cardiac output itself, which incorporates stroke volume times the number of heartbeats. So how much blood is pumped each beat. If this much blood is produced per beat, well, then you multiply that times 60 to 100 beats per minute, and that's what a patient's cardiac output is. So where somebody's got a disease process, their cardiac output is going to suffer, obviously. If they've got a malfunctioning of their valves, their cardiac output is not going to be ideal. If there's a timing issue with their electrical system, the cardiac output is going to suffer. So how can we increase cardiac output? How can we improve the lives of our patients in terms of their cardiovascular fitness? So there's something called Starling's Law, which I have said many times. I take this to mean if you got to be long to be strong, is my statement. And I mean that in terms of physical fitness, athleticism, being limber of the mind, what have you. You have to be long to be strong. You have to be flexible in order to be powerful, right? So a flexible heart is a heart that is trained well, so that is efficient. So when the atria and the ventricles contract, they do so and they eject all the possible blood that they can. And that the valves are healthy and they're permitting all the blood to flow in the right direction. And that the electrical system of the heart is in tip-top shape. So but in terms of the myocardium, the muscle that the heart is, if that heart is well trained and we can fill up these chambers maximally, well, then we can get a good squeeze and we can pump the blood throughout the circulation very effectively. Starling's Law describes that. How can we improve cardiac output or the efficiency of the heart? Well, there are various things that influence it. So there's a neural influence, there's the various hormones and neurotransmitters, norepinephrine, epinephrine, all these neurotransmitters. If, like I talked about, if you're stressed out, well, then your sympathetics are going to be acting up and your heart rate is going to increase. Stress can increase heart rate. Exercise can increase heart rate, but you remember I talked about exercise is a eustress. In other words, you exercise and then you rest, and you exercise and you rest and repeat, and that a training effect is appreciated whereby now your heart is well trained and functions optimally. It's prepared to spring into action if there happens to be a stressor or a need to exert yourself, right? That's one reason why we need to stay in shape, and people say that the heart is the most important muscle. Stroke volume is an equation. It's very simple. Of the of the amount of blood that we have in a ventricle, how much of it can we eject per beat? So if we have a completely full left ventricle, right ventricle, how much of that do we actually expel when we squeeze? That's called the ejection fraction. And I would look more at this image here on the left than any of the nonsense on the right. But the ejection fraction, the higher the percentage, the better. And down low, my third bullet, the ejection fraction is going to decline if there were any injury to the myocardium. According to Starling's law, the more flexible one's myocardium during diastole, or the relaxation stage of the cardiac cycle, the greater the possible contraction. Yes, and you're going to say, in order to be strong, you got to be long. You got to be long to be strong. So that would be true. What's our resting heart rate? 6,100 beats per minute at rest, right? And there's going to be some variations depending upon whether we're male or female, or the size of us, right? You know, you hear about the infants have 120 beats per minute or more. That's physiologic normal for them. If you listen to a hummingbird's heart, it's going to be brrr. If you listen to a blue whale's heart, it's going to be lub-dub, lub-dub. Big heart, big pump, and very more efficient, right? Also, it has to do with metabolism. So larger creatures have slower metabolisms typically, whereas a hummingbird, just the way it is genetically, it genetically exists, it requires a lot of fluttering around, crazy buzzing, almost like a bee, right? So all that activity needs to be serviced by a constantly beating heart. Tachycardia is when your heart rate is too high, and bradycardia is when it's too low. Bradycardia, physiologic bradycardia, normal, would be somebody who's very well trained. So like an endurance athlete, they tend to have low normal heart rates. Why? Because they're so efficient. They don't need to be redlining all the time with their heart rate. Whereas if you have somebody who is out of shape and they climb a flight of stairs, or they need to respond to a stressor some way, their heart rate's going to go way up real quick, and it's going to take a while to go back down, and that is unsafe. Think about when we go out and we shovel snow, which we didn't have to do this weekend, thankfully. Somebody who's deconditioned, say somebody in their 40s and 50s, going out and they don't do any manual labor, they sit in front of a computer all day, and now they're asking so much of their body, putting such a load on their heart and their muscles. So they're going to go into tachycardia, potentially, and it's going to put a hurting on them. Things that affect heart rate, we talked about nervous impact. We talked about endocrine or hormonal impact of the heart. We discussed exercise and the benefits of a trained physiology, making an efficient pump. External stressors like temperature, pH changes. One of the things that really influences the cardiovascular system in a positive way is venous return. In order to pump our blood, we need to return the old blood, so to speak, the deoxygenated blood from the far reaches of our anatomy, because out there by our fingers and our toes and all the far reaches of our physiology, of our anatomy and physiology, the veins must, or that blood rather, can become stagnant, and the gravity is constantly conspiring to push us downward, right? So if we don't do any exercise, we will start to swell in our feet, in our extremities, and you can see that with patients that have heart disease and people who are sedentary that never move. Their feet are going to swell up, and to the point where you can actually press your finger into their shin or their foot and then leave it there, and there'll be a dent that you press. That's called pitting edema, and it's not a good sign. But it's very common in the elderly population and in the infirm, that is, people who are fighting disease. So here's a depiction of the muscular system. Let's say it's in your calf muscle, the gastrocnemius and your soleus. When you walk, those muscles contract, obviously, and deep within our leg, we've got the deep veins. And veins are unique because they have valves. They're one-way valves. So when the muscles squeeze, the blood from our extremities, rather than pooling, now it is encouraged to be pumped up an elevator back to the heart, and that's called venous return. We have to have that in order for us to complete the cardiac cycle and deliver all that deoxygenated blood to the right atrium and then around and around, reoxygenate it, and so on and so forth. Different things can influence our total blood volume. Okay, first of all, you got to keep the blood in the body. Any sort of injury, gunshot wound, internal bleeding, aneurysm, anything like that, that can obviously affect the total blood volume, in which case the heart can't pump blood that it doesn't have. Hydration plays a very important role. People who are dehydrated, they don't have the blood volume, their plasma is very low, the fluid component of their blood. Patients with anemia, with iron deficiency anemia or otherwise, they're going to have problems with their blood volume. It won't be enough, and that which is there, it doesn't have a rich enough supply of oxygen and nutrients in order to help maintain that blood volume. Exercise. Obviously I'm a big fan of exercise. Down below we've got a deconditioned person, somebody who doesn't exercise at all. And above we've got a regular exerciser. Go out and walk, they hit the gym, they do all that stuff. However they train their body, they think that they're trying to lose weight or trying to become strong or whatever, they're also simultaneously training their heart, which is, without it, you're not going to do anything else. You're not going to get in shape or lose weight or anything. The heart needs to function well. Hence, a case is made for cardiovascular exercise, fitness, right? And so if you look at the diameter of these blood vessels here above, we've got nice large supply. We have a large supply of blood to these various organs and systems, such as the urinary system, the kidneys, the brain, the skeletal muscles, the skin, the heart itself, and the digestive system. Exercise can impact all of that AMP, and lack of exercise can really screw over all of that AMP. So that's why athletes and people who take care of themselves and get regular exercise, they tend to be healthier and more well-adjusted because they've got great blood flow. So like the primary case can be made for exercise is all about improving blood flow and delivering blood to the far reaches of our AMP. Name one structural feature that facilitates venous return. One-way valves. Also, respiration, just breathing properly, can help us return our blood and complete our cardiac circulation. Okay, that's the end of the heart. Take it in, easy peasy. And we're going to knock out the circulatory system next. Have a good day.